Thank you so much, Denise, and thank you everybody for being here today. Unfortunately, it took a global pandemic to raise awareness about behavioral health needs, but that's something that we've all experienced over the last 2.5 years. I think we all realize that we're all just one global pandemic away from experiencing depression and anxiety ourselves, and we've seen a shift. Have you felt the shift? We used to talk about stigma. And people didn't want to say that they suffered with depression or anxiety. And we really have felt differently about that over the last 2 years. So where we were, where we've been, where we're going, where we are, all of that theme, I'm going to talk a lot about where we're going. But I wanted to start with 2.5 years ago when this first hit, and we immediately deployed clinicians and counselors to Dr. Arona's site where we were setting up testing, because we knew that the community that was coming through those drive-through testing lines were also in need of emotional support. So that was our team there that came up. We also immediately shifted to telehealth. In 4 days, we had 200 clinicians and providers offering telehealth services. It was a huge, massive pivot. And then the social unrest that we all experienced as a nation hit us. And in Gwinnett County, the Gwinnett Standard, we knew that we needed to do something different, and we were able to start a co-responder program where clinicians ride along with officers, and we think about policing differently now, and that is going to continue to grow. We're so excited about that. But our frontline, our healthcare workers, our essential workers, they've always had a higher need of behavioral health and higher symptoms of behavioral health, and COVID just made that worse. And so some of this data from the Kaiser Family Foundation shows that frontline workers, healthcare workers, EMTs, police, were all disproportionately and still are affected by mental health issues. And so that's all the more reason that we have these partnerships in place where we can provide that support. And it didn't stop there with just essential workers and frontline, everybody. This is more of a global, among the adult population, depression and anxiety symptoms jumped from 11% in 2019 to over 40% in 2021. Not surprising. It's not surprising. We all felt this. So one of the things that came out of these last couple years is some legislation. So I wanted to just talk a little bit about the impact of the Mental Health Parity Act that was passed this most recent session here in Georgia. It's a big bill. There's a lot crammed into it, but I just picked like the top 5 or 6 things that I wanted to make sure that you all knew about. First of all, and Commissioner Foscue will tell you more about this, but she also serves on the Viewpoint Health Board of Directors. But this act finally makes parity law here in Georgia. Woo. That means that insurance coverage has to mirror primary care when it comes to mental health. You have to pay at the same level. This is an act that's been in place for many years, but now it's going to be enforced. Another really big component of this law is the 85% minimum for medical loss ratio. Who all has heard of medical loss ratio? That's not something that's in our vocabulary. Let me tell you what that means. Medical loss ratio is the share of total healthcare premiums spent on medical claims and efforts to improve overall care. Don't you think that's what insurers are supposed to do, is pay for the care? Well, since 2006, when the care management organizations came into Georgia and started managing Peach Care, our Medicaid system for kids, there has not been a minimum medical loss ratio until now. And now that's 85% of their funds that they get to manage that Medicaid now has to be spent on care. That's a major, major change. Service cancelable loans for mental health professionals. If there's anybody in here, and I know that there's one person that is going back to school to get their degree, to become a therapist, go ahead and take out those loans and then come work for Viewpoint Health, because your service time will help you cancel those loans.